Hello and welcome to our quick guide to GIQuest. GIQuest is a lateral flow test that tests for fecal calprotectin and therefore gastrointestinal inflammation in both dogs and cats. Fecal calprotectin is a sensitive, non-invasive biomarker of gastrointestinal inflammation. Calprotectin can be found in neutrophil cytosol, and so when neutrophils disintegrate as part of the inflammatory process, it gets released into surrounding tissues. When that inflammation is in the gastrointestinal tract, it's released into the gut lumen and enters the fecal stream, and so can be found in the feces. It's stable in feces at room temperature for up to 3 days, and it's also resistant to bacterial breakdown throughout the gastrointestinal tract, meaning it's a really reliable biomarker. It has high clinical relevance as well in both human, being used in the NICE guidelines for IBD, and also veterinary medicine. As fecal calprotectin is elevated when there's gastrointestinal inflammation, there are many conditions that can cause this elevation, such as chronic inflammatory enteropathies, including food responsive enteropathy, cutaneous adverse food reactions, as well as neoplasia, dysbiosis, and also long-term oral NSAID use. In a validation study run by Bristol University, GIQuest was tested and shown to be highly effective in differentiating both dogs and cats with chronic inflammatory enteropathy from healthy controls. It was also shown to have a high sensitivity and specificity, with dogs having a 96% specificity and 94% sensitivity, and cats having 100% specificity and 92% sensitivity. It was also found to correlate with clinical improvement in dogs with food responsive enteropathy following a positive diet trial. And it was also shown to detect NSAID-induced gastrointestinal adverse effects, including in asymptomatic animals. So GIQuest is a patient-side fecal calprotectin lateral flow test, which therefore assesses GI inflammation. It gives fast results at the point of care within 15 minutes. It's inexpensive, it's non-invasive, which means it's stress-free for both patients and clients. It supports our clinical decision making and helps us monitor treatment responses. And it also supports our client communication in what sometimes can be quite complex cases. Here are a few clinical scenarios where GIQuest is already being used in practices. Of course, we can use it when there's chronic gastrointestinal signs, both in dogs and cats. It helps us rule in or out the presence of inflammation and therefore helps inform our next steps as to whether we want to do further diagnostics or whether we want to do treatment or diet trials. It can really help when an owner declines either invasive or just any further diagnostics, because it can help provide objective data which can help guide empirical therapy and let us know if it's working. As I've already said, we can monitor treatment response as well as diet trial response, and we can monitor long-term oral NSAID use, which helps us monitor GI side effects even if there's subclinical inflammation. It helps build that client understanding as well as compliance because it can really help provide additional data, which helps explain our kind of subjective view of inflammation. And that can help encourage the adherence to treatment plans or diet trials. It can also really help if there are financial barriers because it offers rapid, cost-effective insights that can then reduce reliance on more invasive or potentially more costly procedures. GIQuest is also being used within the contextualized care landscape. If an owner is reluctant to pursue diagnostics, it can really help provide immediate objective evidence of gut inflammation, and that can help overcome their hesitation and get the owners on board with the diagnostic process. If they have limited finances or they're concerned about further testing, it's a really affordable point of care option, and it can reduce reliance on those more costly procedures. If there are communication challenges, it can really help convert that subjective concern into measurable data. That then makes it easier for the clients to understand the significance of GI inflammation, and it also provides that team element where we can say, okay, we're currently a GIQuest score of 6, and our goal is to get to a 2 or below. And that really helps with the communication and compliance throughout the whole process because you have objective data you can continually retest and come back to. And in those cases where owners want reassurance, again, it offers that objective marker that helps the owners feel confident in the diagnostic path or the treatment plan. GIQuest is really easy to run. You just take the lid off the extraction tube, which has a stick attached to it with 2 little grooves on the end, and you just pop those grooves into the stool. So you need a really, really small sample. You then pop that stick back in, give it a shake for a couple of minutes to mix with the reagent. You then take the bottom cap off, discard the first drop, give it a wipe, and then pop the next 2 drops onto the lateral flow cassette, and then you leave it at room temperature for 15 minutes. After those 15 minutes, you'll have 2 lines show up on your lateral flow cassette. One is a control line and one is a test line. As our test is semi-quantitative, it has 10 scores which are on a scorecard as lines with a color gradient. You just hold that next to the test and read across to the score with the closest corresponding color line to the test line. In dogs, a GIQuest score of 2 is borderline, so depending on the situation, we would tend to recommend retesting in about 2 weeks. And a GIQuest score of 3 or above is indicative of inflammatory enteropathy, and as it increases, that's more gastrointestinal inflammation. In cats, the process is exactly the same. The only difference is that a GIQuest score of 1 is borderline and 2 and above is inflammatory enteropathy. So in summary, GIQuest provides in-house rapid testing for gastrointestinal inflammation in both dogs and cats. It's non-invasive, it can be used for both diagnosis and monitoring, and it can be used at different points of the diagnostic process, depending on what works for the client and for the animal. It aids our current diagnostic trees, and it can help when there are other considerations such as cost or compliance issues. It has a really high sensitivity and specificity, and it was validated by the University of Bristol. So if you'd like to know more information about GIQuest, please do get in contact or visit our website where you'll be able to find more. Thank you so much for listening.